usually not an issue with the well-differentiated thyroid cancers, but an issue with what kind of cancer. If you consider 6 millimeters upper limits of normal, some of the older patients, the upper limits of normal could be a centimeter.
Nearly every minute of Dr. Randolph Gould's working days can be considered a teachable moment. Dr. Gould devotes a good portion of his Virginia Beach surgical practice into finding ways to upload his knowledge of diagnosis, treatment, and patient relationships with students from his beloved Eastern Virginia Medical School.
But my mentors taught me that it's an obligation as a community practitioner and a community surgeon, no matter what your specialty is, to give of your time and energies and to promote the school, to spend time training the medical students and residents. So it's always been a part of who I am, and it's always been a part of who our group is. And I think it's a proud legacy that we want to continue. And there are many doctors in this community that are committed as well to the medical school.
When he's not teaching, Dr. Gould is laser focused on building the most intimate of relationships with every one of his patients. It's an outlook derived from his life's hero.
You know, my dad was really my hero, and he was a general dentist and did oral surgery, and he was a pioneer, I think, and he stimulated my interest in healthcare, and he was truly the best doctor I knew. And he was kind and compassionate, and I remember as a small boy he would call patients after doing oral surgery in the office and check on them that night, and it always impressed me and it always stayed in my memory.
Randolph Gould's ability to understand and empathize with his patients took an acute turn less than a decade ago when he lived the experience of a patient clinging to his own life.
I had my plate full at age 51, and I had a coronary occlusion after jogging, and I collapsed on the street, and luckily my heart restarted, and I went through a frightening time with emergency cardiac bypass surgery and 3 months of rehabilitation, being out of work, and it was a very humbling experience for me. But it not only helped me be a better human being to get, closer to God and my faith, but it also helped me understand what patients go through. It's different to talk about an operation rather than being able to relate that, yeah, I've had my chest split open, I've had a tube in my throat, I've had a catheter in my bladder, I've had lines in my wrist, I've had, pain from surgery, and I've felt lousy from multiple medications. And I think you have a different perspective delivering patient care after you've been on the other side of the table.
Randy Gould is being honored because his outlook toward patients is transcendent. He builds relationships that can be difficult and even heartbreaking. But at the end of the day, those relationships are fulfilling at both ends.
I'm not the hero. They're the heroes. They're confronted with life-threatening illness. They're confronted with a diagnosis of cancer. And the courage and the bravery that many of them, display, is very humbling to me. It's overwhelming to all of us at times. And so we're not the brave ones. We're not the heroes. The patients are the heroes. And I think the more you do this, you realize that. And I have an extreme amount of respect for patients. And some of the patients I put through a lot to get to where we want to be, that suffer through major operations, that deal with anxiety and stress and fear. But I think these people are courageous and heroic in how they deal with illness, and most patients are amazing the way they deal with illness.
This is a mindset he passes on to his alma mater students at EVMS. That includes his own daughter, a recent graduate, and sure to be a success in her own right.
I would proffer that being involved in medical education brings satisfaction. You might do an operation 100, 200, 300 times, but when you're there doing it with a medical student or resident that's seeing it for the first time, it renews the excitement and reminds you why you went into medicine in the first place.